Did you know that unexplained itching in certain spots could be your body's warning about cancer? Many people dismiss a little itch, but for older adults, especially those over 60, itchiness in specific areas might signal something serious. In this video, we'll uncover 5 specific itchy places on the body that could indicate cancer, sometimes months before any other symptoms appear. These are not random itches, they are patterns observed by doctors in patients later diagnosed with serious conditions like lymphoma, pancreatic cancer, and skin cancer. Stay with me to learn the reasons behind each itchy area, the cancers they're linked to, and how to distinguish between a harmless skin issue and something more serious. You'll walk away knowing what to watch for, what questions to ask your doctor, and what actions to take if these signs sound familiar. Sign 1. Persistent itching on the lower legs. When older adults experience a persistent itch on the lower legs, particularly the shins and calves, without any rash or dryness, it might be dismissed as aging skin. However, this specific symptom has been linked to blood-related cancers, especially lymphoma. This itch lingers, often worsening at night, and doesn't respond to lotion like dry skin does. The reason? Cancers like Hodgkin's lymphoma affect the immune system. As cancer cells multiply, they release inflammatory chemicals into the bloodstream, causing a deep, burning itch in the lower limbs. Even if the skin appears normal, the underlying nerves may be irritated. For instance, George, 75, shared that his only symptom for nearly 6 months was an uncontrollable itch on his legs. Initially, his doctor thought it was eczema, but blood tests revealed abnormal white cell levels and swollen lymph nodes, leading to a lymphoma diagnosis. The itch was his first sign. If you or someone you care about has been scratching their legs every night with no relief, don't ignore it. Talk to a doctor and ask about blood work. Sometimes the body whispers long before it shouts, and listening can make a difference. Sign 2. Itching between the shoulder blades or upper back. A specific itch deep in the upper back, right between the shoulder blades, is often ignored and blamed on posture or dry air. However, persistent itching in this area has been linked to pancreatic cancer and can appear months before noticeable pain or digestive symptoms do. When pancreatic tumors grow, they can obstruct bile ducts, causing bile salts to accumulate in the bloodstream. This irritation can affect nerve endings in the back, where many sensory nerves are located. Linda, 70, experienced a phantom itch on her upper back. Despite trying various remedies, nothing helped. Blood tests for unrelated fatigue revealed elevated liver enzymes, leading to the discovery of a tumor pressing on her bile duct. The itch was her only symptom. If the itch is focused and unrelenting, and if you notice darker urine, pale stools, or fatigue, it may indicate something serious. Older adults shouldn't dismiss these subtle symptoms. When your body sends repeated signals, it's worth listening, even if it's just an itch. Sign 3. Itchy scalp without visible flakes. An itchy scalp might seem trivial, often attributed to dry air or aging skin. However, persistent itching without dandruff or redness can signal deeper issues, including blood-related cancers like leukemia or skin cancers affecting the scalp. This itch often feels more like tingling, crawling, or burning than dryness. It may move around and doesn't respond to typical treatments. For older adults, such sensations can indicate nerve irritation triggered by abnormal immune activity when leukemia cells multiply. Henry, 73, noticed his scalp itching every afternoon. After changing hair products and trying various remedies, he had a blood panel done for unrelated fatigue, revealing high white blood cell counts and a diagnosis of chronic lymphocytic leukemia. His scalp was the first alert. Many older adults experience skin sensitivity, so an itchy scalp might be ignored. However, cancer-related itch is often resistant to treatment. If it lingers and doesn't improve, it's a sign to seek medical advice, especially if you're feeling more tired or bruised than usual. If you're still watching this video and finding these insights valuable, please comment number 3 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Sign 4, localized itching on the chest or breast area. When older adults notice persistent itching on the chest or breast area, particularly around the nipple, it can be easy to attribute it to sweat or skin thinning. However, this area is often overlooked, yet itching here may signal inflammatory breast cancer or underlying tumors. This itch often appears before any lump. The skin might feel warm or irritated, and sometimes there's a change in texture. However, often there's no visible change, just a persistent itch that won't go away. Ruth, 69, noticed itching around her right breast and tried various remedies, but the itch persisted. During a checkup, her doctor noted slight skin dimpling, leading to tests that revealed an aggressive tumor near the skin surface. Itching that remains focused and doesn't ease with moisturizers, especially if accompanied by swelling or warmth, deserves attention. Male breast cancer is rare but can occur, and men may overlook symptoms like an itchy patch near the nipple. Sign 5, persistent itching in the anal or genital area. Itching in the anal or genital region is uncomfortable and often ignored. However, when this itch becomes chronic with no apparent cause, it may indicate something serious, such as anal or vulvar cancer. This type of itch often disguises itself as a minor issue, attributed to dry skin or friction. But when it lingers for weeks or months, and feels more raw or burning, it warrants investigation. Eugene, 76, dealt with what he thought was hemorrhoid irritation for nearly a year. After seeing a colorectal specialist, he discovered a small lesion on the anal canal wall, which was an early-stage tumor. For women, vulvar cancer becomes more common after age 60, with persistent itching being an early sign. If the itching worsens at night and doesn't respond to treatments, it's crucial to seek medical advice. Final thoughts. As we close, remember that your body communicates in subtle ways. Sometimes it speaks through pain, other times through fatigue, but often it begins with something small, like a persistent itch. The 5 areas discussed, the lower legs, upper back, scalp, chest, and genital region, are where serious internal issues often first signal. For older adults, learning to listen to these signals could mean catching something early. This isn't about living in fear, it's about empowerment. What seems like a small symptom may be your body asking for help. If any of these signs felt familiar, don't brush them off. Discuss them with your doctor. You deserve answers and peace of mind. Thank you for joining us today. We'd love to hear from you. Share one thing you learned and how you plan to use it. Your thoughts are important, so don't hesitate to share them. If you found this video helpful, please like, subscribe, and share. Your support helps us create more content to inform and inspire you. Thanks for watching.